Next is allergy shots. So these are common procedures that are being done in a physician office. So what happens is shots, it can be injections of any type. Here when it comes to allergy shots, these are very different from the other injections because those injections are for diagnostic or for therapeutic purposes or for like pain management, right? Whereas giving an allergy shot is different from them because patient can develop hypersensitivity reaction and could result in an adverse reaction. For allergy injections alone for administration, we have a different codes depending on the number of injections that are being given. So you can report code 95115 for one injection and 95117 for 2 or more injections. Next, you might have seen an allergist or a patient who has severe allergy would be given battery. It's like a pack of vials of injections. The doctor will figure out which the patient is being allergic and he would start preparing this particular antigen in a kind of way so that he is going to inject this particular antigen to which the patient is allergic so that the patient develops a kind of immunity to that particular antigen. Can you understand? So these are very different from the usual therapeutic injections because what happens here is the doctor is going to develop a kind of immunity against this antigenic stimulation or that cause adverse effects. So they might be injecting various venoms, they can be giving various kinds of antigens as well. So here you should understand certain things. One would be like there is a professional service involved in the creation of such vials or creation of such medicines for these patients to be given. That is a supervision or it is a professional service there. Second thing is like administration. The doctor is going to give this particular injection to the patient. Thirdly, about supplies. Supplies in the sense like in 95115 or 117, the supply was given by some other doctor. Here, this healthcare provider is only administering the injection, right? There is no provision of this antigens or the venoms or the extracts. Whereas, if you see from code 95120, 125, 130 onwards, there you have like that includes the supply of antigens. So codes from 95120 includes the supply of antigens and the administration of these injections. Whereas if you find codes from 95145, that includes the injection, that includes the supply, and that includes the professional service in the preparation of such antigenic substances. Here what the provider can do, either he can create a vial which is one dose or with many doses. So sometimes we have to code for the number of doses as well, because when you go to 95144, these are all for single dose vials, just one dose. If the physician is going to use multiple doses, then you will have to multiply accordingly.